Hello, everyone, and welcome. So before we begin today's call, there are a few logistics and tech etiquette to highlight. Donc, la session va se dérouler en anglais. Si vous avez besoin d'interprétation, cliquez sur le bouton d'interprétation en bas de votre écran. Sentez-vous bien à l'aise de nous poser vos questions dans le chat en français et ou en anglais. We will have participants muted throughout the presentation period, and then we will change that setting for the Q&A section. At that time, please keep yourself muted when you're not speaking to reduce some background noise. And if you're joining us by phone, you can click *6 to do so. If you're comfortable keeping your camera on, we invite you to do so today so that we can see who's in the room with us. We invite you to place your questions in the chat box throughout this event so that we can answer them later. Only the speaker will be recorded during the presentation. So when we start the Q&A portion, though, you can turn off your camera if you do not want to be recorded. And as your tech host today, I'll do my best to support any needs that arise. So you can send me a message in the chat if you have any problem you need support with. So now on to Leanne, who will be facilitating today's event.
Hello, bonjour, que, bienvenue, welcome. What the Food, episode 5, the state of household food insecurity is our topic for today. And just thank you all for joining us. I am Leanne Prescott, the interim director for Food for All NB, and my pronouns are she and her. And I'm joining you today from the ancestral and unceded lands of the Mi'kmaq at my home in Moncton, New Brunswick. Food for All carries out its work across traditional unceded lands of the Wolastoqey, Mi'kmaq, and the Passamaquoddy nations. We're governed by the treaties of peace and friendship first established between the Crown and the Wabanaki Confederacy tribes in 1726. And with this acknowledgement, we raise awareness just as a first step in making change. We all have a responsibility as treaty people to take action that uphold the treaties intended to be the basis of nation-to-nation relationships, and that recognizing the lands and the waters that feed us and bring us life. So I encourage all participants in our actions and discussions here today to find opportunities for us to uphold these treaties and to consider how we might do so in this work and in our broader lives. So Food for All NB, as many of you know, is a provincial bilingual organization that envisions a New Brunswick that is informed, connected, and engaged in food security. And we work to advance food security in New Brunswick by supporting champions, sharing information and resources, and supporting food actors on the ground and around decision-making tables. So for today's session, we are very excited. This is the first What the Food episode that we're having in 2022, and we are thrilled to welcome back one of our very first guests, which is Dr. Valerie Tarasuk. And Dr. Tarasuk returns to share an update on the state of household food insecurity in 2022, and to help us talk about some of the common misconceptions tied to household food insecurity and emergency food systems. So during this event, we're going to be learning more about what's changed since 2020. We had a sneak peek at some of the data, and it's pretty notable, the differences. And so we're going to see some examples of success and areas of critical need as well. After Dr. Tarasuk shares with us, we'll have plenty of time for a Q&A, and we're going to open breakout rooms so that we can continue on the discussion and go a little bit deeper and hopefully make some connections with some people doing similar work. So with that said, I want to present to you Dr. Valerie Tarasuk. Dr. Valerie Tarasuk is a professor in the Department of Nutritional Sciences at the University of Toronto. Cross-appointed to the Dalla School of Public Health, her primary research focus is household food insecurity, and she's led several tri-council research grants to explain the scope, nature, and health implications of this problem in Canada. Assesses the effectiveness of community responses and determine how public policy and programs impact food insecurity, prevalence, and severity. So for the past decade, she has led PROOF, an interdisciplinary research program designed to identify effective policy approaches and mobilize knowledge to reduce household food insecurity in Canada. Welcome, Dr. Valerie Tarasuk.
Thank you very much for that introduction, Leanne. And I will start sharing my screen here. It's really a pleasure to begin the food session with you folks. Now, just if I can get confirmation that the slides are looking as they should. Leanne, yes? Is everything okay?
Yep, looks good, Val.
Okay, thanks very much. So yeah, it's a great pleasure to be a part of this session today. And I'm delighted to see all of you here. Okay, start as always with the talks that we give. I just want to anchor very clearly what I'm talking about when I talk about food insecurity, because the term is being used just so widely right now. What you're seeing here is a very cursory summary of the 18 questions that are used on large Stats Canada surveys routinely now to measure household food insecurity. The questions range from worrying about not having enough food through to compromises in the quality of food, and a whole bunch of questions about quantitative compromises, always with a clause attached to establish that the problem is because there's not enough money for food. We analyze this module by grouping people in 4 categories based on the number of affirmatives that they have on these questions. And the most important, I think the most extreme, is this terrible condition at the end, food insecurity. Okay, here's what the story looks like right now. This is us presenting now. We have moved in PROOF from the Canadian Community Health Survey to talking about the Canadian Income Survey. It's a relatively new thing for the Canadian Income Survey to include the household food security module. But we see it as a really important development because we think the survey is more representative. What's also really interesting about this survey is it traverses the pandemic. So for the first time, we've got a window into what's gone on in terms of household food insecurity over the last 12 months. I'm sorry about the background noise here. I'm sure others are noticing it as well. It's not coming from my end, but I apologize if it's distracting for you as it is for me. Okay, so here's what we've got, and I'm flagging here the times of the interviews. So our most recent data come from 2021, and remember these are measuring food insecurity over the last 12 months. 15.9% of households experiencing some food insecurity there, and that translates into 4.8 million people. So this problem is huge. Yes, there was a little bit of a dip here, and this is around the beginning of the pandemic, but we are sitting in a very stationary place right now, and it's at a very high place. Here's what it looks like across the provinces, looking at the data just for 2021. We only have data right now for the 10 provinces. We don't have data for the territories yet out of the Canadian Income Survey. But just to flag a couple of things. The highest number on this slide is Alberta at 20.3% of households. So 1 in 5 households in Alberta reporting food insecurity. The second highest is New-Brunswick. At the bottom end, we've got Quebec. And this has become a continued theme for us in looking at national data, that Quebec is pulling away as a distinctly different story when it comes to food insecurity. But let's go back to talking about New Brunswick. You can see that it's at the high end of the Atlantic provinces. But you know, in the zone of Saskatchewan and Alberta on this particular survey, if we look over the last 3 periods of measurement, here's what New Brunswick looks like. The 19% that's been charted in the 2021 data collection is certainly higher than anything that's been observed before. And I said earlier, we've got 5.9 million Canadians. We've got 140,000 people in New Brunswick who are food insecure, at least according to these data, and that includes 1 in 4 children. I want to draw your attention to something else here, though, before I leave it. Undoubtedly, you're noticing the dip, and it looks like things got better in 2020 and then worse in 2021. Be cautious in making that interpretation. You know, there's a temptation to say, gee whiz, what were we doing right in 2020 and what are we doing so wrong in 2021? But the red line here is showing the uncertainty around these estimates. And in fact, statistically, there's no difference between these 3 years. This 2019 data, or actually 2020, called CIS 2019, it began in 2020 and then was pulled out of the field in March of 2020 when the pandemic hit, and then went back in July. So there's some oddities about that period that I think might relate in particular with the story in New Brunswick of the dip. So just flag, don't take that too seriously. Don't anybody beat themselves up for thinking things have gone backwards. It could be that they're just actually where they've been all along, maybe slightly different than the 2019 numbers. Okay, but we're in a very, very turbulent time right now with inflation, and for sure with food price inflation. The data I've just showed you, the collection would have stopped around here, September of 2021. So we're looking at 12 months going backwards. What we can see clearly from these data is that inflation has continued to rise since this data collection from 2021. In another few weeks, I think another 1 week actually, we're going to get another report from Statistics Canada with updated inflation figures for Canada. I think it's pretty clear that those lines we're seeing going up are going to keep going up. So who knows where we're headed, but this is not a good thing, and it's certainly something we need to attend to as we go forward with talking about policy. Okay, what's at the root of this problem? Well, the work that we in Proof and others have done points squarely to this picture, that we have a story. Who is most vulnerable to food insecurity are people with inadequate, insecure incomes. And it coupled with that, a lack of assets, the primary asset in Canada being home ownership. As income falls, the likelihood of food insecurity rises. And when we look at home ownership, those who rent rather than own their homes, or who own with a mortgage, are always more vulnerable to food insecurity than those who don't. We think that's about the fact that the owner has capital that they can draw upon if something else happens. We've often talked about the story of main source of income in Proof presentations, and I want to give you an updated figure here. This is from the data from the 2021 data collection. And again, you can see what has become a predictable pattern, right? With people on social assistance having a very, very high rate of food insecurity and a very, very high rate of severe food insecurity. And at the bottom end, we've got people on retirement incomes. And here we've separated the private pensions from the public ones, and also taken a look at salaries and wages. To start at the top here, just to give you a figure for New Brunswick, it's a bit higher than the national average at 71.7% of households who in 2021 reported their main source of income as social assistance being food insecure. I want to draw your attention to these two figures though, because remember, this is 2021 data collection. So it's people reflecting on 12 months during the pandemic. And so now we've got a window into the famous COVID benefits, and most particularly CERB here. About 80% of what's in this bar is CERB, and the rest is things like the recovery benefit, the sickness benefits, other things. But you can see that while CERB was a wonderful thing in that it insulated a lot of people from extreme hardship when they lost work, it didn't do that job perfectly, right? 41.6% of households that report their main source of income as COVID benefits are food insecure. And that's almost in line with the a fraction that were reporting their main source of income as employment insurance. It's a much smaller number, obviously, because EI was kind of consumed by things like CERB eventually. But just to flag that part of the reason those food insecurity numbers that I showed you haven't dipped further, I think, is because this was an imperfect system. For many people, it looks like it wasn't enough money to insulate them from hardship. That said, we still have a very big story of food insecurity amongst people in the workforce. Again, about half, even during the pandemic, about half of the food insecure are sitting in the workforce. And here you see New-Brunswick, it's no exception at 53.5%. How come? Well, if you looked at our earlier slide, 1 in 7 households in the workforce is food insecure in 2021. And so they're still making up a fairly big chunk of the storyline here. A few other things just briefly to touch on. There is a heightened vulnerability of food insecurity amongst particularly working-aged adults and children. Seniors have a much lower rate, especially when we start to do more complex multivariable analysis where we take into account things like home ownership. Food insecurity is racialized. As you'll see in the report that Proof is preparing to release, those with the lowest rates of food insecurity are white. We also know from prior work that we have an appallingly high rate in Nunavut. And lastly, something that I can't help but flag in the context of this group, we don't see any evidence that food insecurity is related to food skills or to food retail access. So while those are issues, someone who's got a garden or someone who's living in a food desert or not, we can't see evidence that that's enough to move the needle on this very significant problem. As you'd expect, food insecurity is associated with poor nutrition. And that makes sense, right? I mean, people are reporting that they have poor access to food. They're sometimes having to compromise the quality and the quantity of what they eat, so their diets aren't as good as people who are food secure. What's clear is that food is only one of the problems that food insecure households are facing. As soon as we scratch the surface, we can see that they're struggling to pay rents or mortgages if they have them. They're struggling to pay other sorts of bills like phone, internet, utilities. If they have prescription medications with any cost associated with them, even if it's just a small dispensing fee, that becomes a problem for people filling those prescriptions and taking those medications as prescribed. So while we identify people as food insecure through those 18 questions asking about their ability to meet their food needs, as soon as we look deeper, we see that it's just one of multiple struggles that they're engaged in to meet basic needs because they lack the resources to do that. It matters because, among other things, it is a potent determinant of health. The health conditions that associate with food insecurity go way, way, way beyond nutrition. And we just keep adding to this list. We can see that people have a higher risk of both non-communicable or chronic diseases, things like cardiovascular disease, but they also have higher risks of infectious diseases and higher risks of injuries, poor disease management, you name it. Basically, negative health conditions, almost without exception, are associated with, they're increased if we're looking at people in food insecure situations. Especially when we look at mental health issues, we can see really, really strong relationships. I mentioned infectious diseases, and I want to just flag that at this stage, we don't have data on COVID. But everything we know about the patterning of COVID infections in Canada would suggest that when we finally do see some data on COVID infections, we're again going to be able to add that to this list of infectious conditions that have been more prevalent amongst people in food insecure situations. Now, I know that there are many people on this session today who have been at other sessions with Proof and have even been involved in Proof in some cases, which is lovely to see. So you will be so sick of seeing this slide, you're rolling your eyes now. But for those who haven't seen it yet, I want to imprint it on your memory. If there is a business case to be made to intervene on food insecurity, I think it is the intersection between food insecurity and health. And what you're seeing here is work that we did in Ontario a few years ago, using health administrative records in Ontario and linking them to information about household food insecurity status from the Canadian Community Health Survey. All we're doing is looking at working-aged adults' healthcare usage over a 12-month window compared to their household food insecurity status over that same 12 months. That's it. And what you can see is a very, very strong linear relationship whereby the more severe the food insecurity, the higher the number of healthcare dollars those people consume. The bars are broken up to reflect the different types of healthcare services that are covered under the public purse. And you can see that in all cases, there's a difference, that it's not just that people who are food insecure are more likely to turn up in emergency departments. Yes, they are, but they're also more likely to show up in a doctor's office, in a physician's office, in a hospital, and to require other sorts of healthcare services that are covered under the public system. So this problem is costing people money. More recent data, just to give you an illustration of the spectrum, this is more recent work that we've done looking at hospitalizations in Canada. And unlike the Ontario costing data, which sadly at this stage, we've only ever been able to figure out how to do for Ontario, but we're able to look at things like hospitalization and emergency department visits across the country. And so here's what we've learned about hospitalizations. And people who are in food insecure situations are more likely to be hospitalized and to stay in hospital longer. Think of the dollar value of that. Why? Well, here's the spectrum of conditions. It's almost everything. The only condition here that isn't associated with increased likelihood of hospitalization is cancers. But everything else, these little stars are indicating significant results. The red line is saying that in this case, well, let's take the example of respiratory system diseases. So things like asthma, COPD. People who are food insecure and living in a severely food insecure situation were 2 times as likely to be hospitalized for derailing of respiratory conditions. But the really, really strong relationship, the strongest one we ever see when we look at healthcare utilization, is for mental health issues. And here you're seeing that we're almost at the 3-point mark here, whereby people in severely food insecure situations are almost 3 times as likely as food secure people to be in hospital for reasons of mental illness. So this is what that healthcare costing is all about. That backdrop, we have another story that is one that I'm afraid we have told for way too long. The primary response to food insecurity in Canada continues to be food charity. And this is a response that has escalated in magnitude through the pandemic. In the beginning of the pandemic, we saw the federal government introduce the Emergency Food Security Fund and something called the Surplus Food Rescue Fund. And over the last couple of years, they have just steadily added money to that Emergency Food Security Fund. What's it for? It's to fund food banks and what they're calling other national food rescue organizations. But this would include things like Breakfast Clubs of Canada, Second Harvest, the Salvation Army, the community food centers. But they're doing this to help improve food access, they say, for people experiencing food insecurity. The Food Rescue Fund is again heightening the movement of food waste into food charities, ostensibly to address food insecurity. That's at the federal level. I want to just flag for you, we didn't do this before the pandemic. That $100 million that got introduced in April of 2020, we had never seen anything like that in Canadian history before we hit that April 2020 announcement, and they just kept coming. In the announcements from the federal government, we've seen most provinces also putting money on the table for food charity. And again, the announcements keep coming. It wasn't like it happened in the beginning when everybody was in crisis mode back in the spring of 2020 and rapidly trying to figure out what to do about this terrible problem. No, here we're looking at an announcement that came from the New-Brunswick government in June of this year. And what are they doing? They're adding an extra 100 million. So this is the second 100 million being contributed to a food charity organization to help them meet increased demand. So under the guise of responding to the problem of food insecurity. As this keeps going, and New Brunswick is not unique here, but as the investments in food charity keep getting piled on, I feel like it's more important than understand what this is about. Because what is happening, the investment are achieving something. They are expanding our food charity system. This is a graphic that I lifted from Second Harvest, that is Canada's national food rescue organization. If you go on their website, you'll see a little logo there that says "No waste, no hunger." And so what they're doing is moving food that otherwise they say would be landfilled into food charity operations. In December of 2020, they released a report that was commissioned by them with funding from Walmart for a consultant to look at the scale of food charity in Canada. And they found something really quite shocking, that we have more than 4 times the number of food charities compared to grocery stores in Canada. I think this is partly about the fact that now we are pouring so much public money into food charities that we are enabling an expansion. How does it relate to food insecurity? Well, here's what we can figure out for the province of New Brunswick in 2021. What I'm showing you on this bar is the number of people living in food insecure households in New Brunswick based on the most recent data we have, the best data that we have on food insecurity in Canada in 2021. And here we've got the purple bar, the number of New Brunswickers in that situation. Here's the number of food bank visits that were reported by Food Banks Canada for the province of New Brunswick in March of 2021. Now, these are visits, not individual people, so there could be a person who's visited twice. It's only referring to food banks, so it isn't picking up other food charities, so there may be people going to other sorts of food charities that weren't counted here. So maybe the green bars should be higher, maybe it should be lower, but you can see that it would take quite a lot for that green bar to reach the purple bar. And that's the point of this slide. I'm showing you the picture for New Brunswick. It is no different than the picture that we see across Canada. It's no different than the picture that we have seen for years now as we've started to match food insecurity data with food bank numbers. The scale of the operations, even though when you look at something like this, you think, oh my goodness, the scale is gigantic. When you look at this, you realize that scale is nothing compared to the problem of food insecurity in this country. Okay, but that's not even the end of the story. When we and others have done studies looking at people who use food charity, what we can see is that they are no better off than those who don't. So it's not like we'd have less food insecurity in the country if we just expanded the food charity so the green bar equals the purple bar. What we know from studies that have happened looking at people using food banks is they're very likely to be severely food insecure. No question, using food charity is an act of desperation in an affluent country like ours. But using food charity isn't enough to cause somebody to be food secure. Food banks, no matter how much money the public purse loads onto them, will always be limited in terms of the amount of assistance that they're able to give to any one person, because demand always exceeds the supply. So what we can see is that, yes, they're seeing some people who are desperately in need of help. No question, the people who receive that assistance are grateful for it. But it's really a mistake to conflate this activity with the very real problem of food insecurity and the need to address that problem. Because this activity of giving food charity doesn't actually change anything about the statistics on food insecurity. And those statistics need to be changed. What does move the needle on food insecurity? Well, public policies that improve the incomes of people at the bottom end of the income spectrum. It's as simple as that. Improving income, the adequacy of the incomes and the security of those incomes is critical to dealing with the worst of the food insecurity that we see in this country. What I'm showing you on this slide is a laundry list of studies that we and others have done looking at particular public policy interventions in Canada, either at the federal level or at the provincial level, and how those changes related to changes in food insecurity status. I'm going to just amplify a couple of them for you, just to give you an illustration of what these look like. But basically, anytime we've had an opportunity to model statistically a change in policy that has added income in some way, or to people who are at risk of food insecurity, we've seen some level of reduction. To illustrate what that looks like, I'm going to talk about the Canada Child Benefit. This is a signature act of the Trudeau government. It's their poverty reduction strategy for children living in poverty. It was introduced in 2016, not necessarily all new money, but harmonizing or rationalizing some other programs that existed and putting some new money on the table. At the point that we did this analysis, the benefit levels were maximum were $6,400 per year for families with children under 6, that's per child, or $5,400 for children 6 to 17. They've gone up slightly since then, but really not that much. We're still not at the $7,000 mark or the $6,000 mark here. When we looked at provinces and the rates of food insecurity pre the introduction of the Canada Child Benefit and after, what you can see is that these bars look very similar. Most families with children are food secure, which is great. And there are some that aren't. And those changes were really very big, and they actually weren't particularly significant. But we did some more elaborate analysis, focused in particular on this red bar, severely food insecure. And here's what we learned. When we looked at the prevalence of severe food insecurity before and after the introduction of the Canada Child Benefit, we can see households without children, nothing moved. But for households with children, there was a substantial drop. These numbers are not big, but 4% is 3.6%. I mean, we're talking hundreds of thousands of families in those numbers, so they're not small. But the story became more interesting when we looked at low-income families. When we looked at low-income households, now we saw a profound drop. The rates of severe food insecurity were much higher to start with. Now we're talking about 12%, 12.3% for families with children, 12.7% for those without. So a very high rate of severe food insecurity. After the introduction of the Canada Child Benefit, this rate dropped by 1/3, which is fabulous, right? What does it tell us? These people would have been very low income to start with. The Canada Child Benefit gave them more money. And when they got more money, those who could reduce their level of extreme deprivation. So severe food insecurity dropped. Nothing changed in terms of moderate or marginal food insecurity. So it's not like these people were out of the woods, but the rate of severe food insecurity decreased, which is really, really important. Okay, so we could see this as a victory, right? That the Canada Child Benefit has reduced food insecurity, at least in some way, severe food insecurity amongst families with children. And indeed, we've seen this research cited at times to talk about the Canada Child Benefit as a success story, not just in reducing child poverty, but also in reducing food insecurity. Okay, yeah, but it's not enough, right? We've still got, at this point in time, 8.2% of families with children in severely food insecure households, and we still have a lot of others. So it's not like the story is over. We're continuing to do more examination of the Canada Child Benefit with the 2021 data that I've shown you earlier in this presentation. And eventually, hopefully before the year is out, we will release another paper on the Canada Child Benefit. But it's not going to be a good news story. I think the bottom line here is that there isn't enough money in that Canada Child Benefit going to very low income families. And so many continue to struggle. What about provincial policy? Well, we've done a look at provincial policies, and there's no question that they matter. We recently looked at a whole bunch of policies across the 10 provinces to try to understand what drove the differences in prevalence of food insecurity between provinces and within provinces over time. And we were able to identify 3 things, and they're probably going to be obvious to you already. We can see that increasing minimum wage matters a lot when it comes to food insecurity. So a $1 increase by our calculations at that time, at least, were associated with a 5% decrease in the odds of food insecurity. We also could see an effect of increasing welfare incomes on severe food insecurity. And we could see an effect, and this is in red because our calculation is in an opposite direction. If you increase the amount of income tax, provincial income tax that is levied against the lowest income people in the province, you will increase the odds of food insecurity. So raising welfare rates, raising a minimum wage works well. to lowering taxes is also a good idea. Now, from what I can figure out, and I don't pretend to be an expert on public policy in the province of New Brunswick at all, but in the lead up to today, I've been doing some reading and I've been helped by some people on this call. And it looks like New Brunswick has been heading in the right direction, right? You've had some very significant increases in minimum wage recently. And there have been some reforms to social assistance in New Brunswick that I think the rest of this country could learn from. It's really, really impressive to see the increases in rates and also to see changes to things like that earnings exemption. And from what I can understand, and again, I don't pretend to be an expert, it looks like there's been a bit of an alleviation in taxes. So in tandem with the funding of food banks that I'd be happy to provide advice to the province on in the future if they're interested, in tandem with that, it looks like there have been some really, really positive changes in New Brunswick in terms of the policies that the province has under their control that could influence the rate of food insecurity. What will happen going forward? I mean, will the 19% that we charted in 2021 go down? Well, it depends on how these very, very positive moves play out in relationship to two other things that sadly are not as tightly in the control of the province. That being inflation, but also what happens with employment rates. So I want to end with this, that I know there's a lot of work happening in the province right now, and that June 1st announcement is a good example, to try to figure out how to help low-income families through this period of inflation. And it's really good that people are thinking along those lines. But our work would suggest that what's really needed is a commitment to income support programs. And by that, I mean not just things like social assistance, but also paying attention to the role of wages and employment standards so that people end up with adequate and secure incomes, and that those incomes are designed in such a way as to be responsive to the cost of living. Okay, I just leave you with a bit of food for thought on this slide. There are two ways for us to get there, maybe at least two ways. One is to do continued kind of piecemeal measures, doing things like the province has done with minimum wages and social assistance benefits, maybe like the federal government is doing or could do more of around child benefits. Other sorts of changes to individual policies that together right now create the income floor for people who are at risk of food insecurity. That's one way to look at this. Another way to look at it is to take a more radical approach, and I know it's one that people in your province are talking about, and to consider a basic income as a one-size-fits-all approach as opposed to the piecemeal approach. Both are good. Both are worthy of a whole lot more conversation. But going forward, I just want to emphasize again that the evidence sure points to the need for policy interventions that will deal with the underlying causes of food insecurity to get these numbers down. I'll pause there, and I will be very interested to hear your questions and comments. Thank you for the opportunity to share this work, and please watch out for us. The data I've shown you for New Brunswick is part of a report that is very much a work in progress, and hopefully will be released in the next, the next month certainly, but maybe before then. Thank you. I'll stop sharing my slide now.
Thank you so much, Dr. Tarasuk. Thank you for sharing your research and your passion with us today. I can hear it in your voice. And for many of us on the call here this afternoon, there are folks that are working directly with food insecure people. There are folks that are working on the systems and trying to help improve and advance food security in the province. But oftentimes we don't have time or access to the numbers and the statistics that you've shared with us. So this will inform greatly the work of all of us joined here today. But also, I know that for myself, it just reinforces that sense of purpose. It reinforces that, there is still a great need, and the pandemic has shifted a great many things, and we know it and we see it and we feel it, but now we've got those numbers that are there to go along and to support our proposals and the work that we're pushing forward. So Please feel free to put your questions in the chat box. And if there's any questions on the French interpretation side of the call, we'd love to hear those at this time as well. So we have a question here from Nadine Peters. It says, I'm wondering about the actual food waste from large stores. Recently, I saw a post about people dumpster diving in New Brunswick and finding all sorts of food that is perfectly usable, that is being thrown away by large chain stores. What are the legal implications of large stores giving away food to things such as pay what you can grocery store?
Well, okay, the short answer is I don't know. Way back in the 90s, we saw what's called Good Samaritan laws came forward, and New Brunswick has one of those as well. So if food industries, so grocery stores or food manufacturers, want to, they can donate food to food charities. And the Good Samaritan Act absolves them of liability for the health and safety of that food. What happens if they donate to a pay what you can store? I honestly don't know what the liability issues are there. But, you know, there actually is something else that they could be doing with that perfectly edible food that people are finding in those dumpsters. They could be selling it at a discount in their stores. Mm-hmm. And there's a little bit of that happens in some stores, at least near me, but there's not nearly as much of it that happens as could be happening. And everything we know about people who are struggling with food insecurity is that they would rather get their food in stores the same as the rest of us as have to go to a food charity for it or dumpster dive for it, I'm sure. So, you know, to make that food more affordable and keep it in the store as opposed to putting it in the dumpster, I think is the simplest thing, rather than us having to create new structures and new legislations. We don't want food that is unsafe being sold or given away. There's no question there. And there are some products that, because of you know, mishandling or whatever, or time, may actually become not good to eat. The retailer is the best person to make those decisions. They already are following a whole bunch of laws that help them to do that. So I think what we should be doing with those big outlets with the dumpsters is going back in those stores and saying, what are you doing? You know, we don't really need to put taxpayers' money into food waste recovery efforts. You could be just actually managing that yourself.
Yeah, I know the conversation around normalizing ugly food comes up from time to time in our work as well. There's a question here. Does Dr. Tarasuk have advice for funders of food charities in evaluating opportunities to lend support?
Well, I think that funders of food charity might want to ask themselves why they're doing that. One thing that we know many food charities do, and I don't want to condemn them for this. I mean, there are many people working in the front lines of relief organizations, whether it's food charity or it's people working with parent programs or homeless shelters or other sorts of programs that are working on the front lines. Many of the people who were involved in that work are very, very strong advocates for public policy changes. And that's a really, really important role that they can play. And that's a role that I think funders, if they wanted to do something progressive, they could support. Now, often people say, oh, we can't do that because we won't get a charitable, tax receipt if we fund, political activity as opposed to just straight charity. And I think, well, again, that's the time for those funders to look in the mirror and ask what they're trying to achieve. Is it a tax write-off, or is it to do something positive in their communities? So I would say supporting advocacy is really, really an important thing to do. The other thing that I think we need to push back around with large corporations that are very deeply engaged in the support of large charity organizations is to ask them to take a little bit of a look at their own practices as they relate to things that are underpinning food insecurity. We know even during the 2021 period, about half of food insecure households in this country were reliant on employment incomes. That means we have a bunch of employers who were paying people in some way for something they were doing that presumably was of value to the employer, but doing that in a way that did not enable those people to afford food for themselves and their families. That needs to change. And part of changing it is those employers changing it. So when I see something like the Walmart Foundation funding the Second Harvest study to look at food charity, I want to say, come on, Walmart, think, what are you doing in terms of your own workers? Are they food secure? And if they aren't, how is your pay structure working and your conditions of employment? How are they designed? And what could you do to ensure that anybody who's working in Walmart is able to afford the food they need for themselves and their families? And let's go down the list, right? So again, I mean, it's so often with food charity, the donation is all that anybody talks about, and it's thank you for the to the donor and how wonderful it is. But we've got a serious problem on our hands. And part of the problem is that we think we're managing it by food charity. So I do think we need to look upstream. Okay, and now that's too long an answer, Leanne. I promise I'll make a shorter one for the next question, as long as it isn't about this.
No, that's great. I see we have 2 more questions here in the chat box. So we have, hello and thanks for the presentation. Further to Nadine's question, I was wondering if there is any correlation between food insecurity and food waste in the household level. A possible negative correlation could suggest a behavioral type of intervention to reduce food waste, while otherwise could be more structural problem of the supply chain.
I don't know. I think it's a very interesting idea. I would hypothesize, and it sounds like the person asking this question has the similar hypothesis, that someone who is struggling to afford the food they need can't afford to waste anything. And I suspect that they don't. So, studies that we and others have done suggest that people who are food insecure have food skills. They have at least as much food skill as the rest of Canada. Maybe that's not enough, but they've certainly got something. And so it wouldn't surprise me at all if we find lower levels of food waste amongst people that are, budget constrained and really working to maximize their dollars. And that would be an interesting thing to evidence. But remember, this food waste problem, the biggest culprit of the food waste problem isn't households, whether they're rich or poor. The biggest culprit is actually the food manufacturers and food retailers. So while yes, individuals can do things to minimize food waste in their homes, for us to deal with the bigger issue of food waste, we have to get to the sources of it that are outside our homes.
I just want to also ask Kemi if there's any questions that are in the French interpretation side of the call. And because we want to make space for that as well. But I do have one more question here. On the issue of public advocacy, a new coalition of partners led by the Greater Fredericton Social Innovation is forming to promote advances in basic incomes. Oh, actually, it's more of a public notice than a question.
Excellent. All the better.
Is forming to promote advances in basic income and collaborating with similar groups across Atlantic Canada. Stay tuned for more. So that wasn't so much of a question, but that's good to know. Yeah. So I'm just waiting for a thumbs up from my team to say we're all good on the no questions on the French interpretation side. So I want to take the opportunity again to thank you. As you were ending your presentation, there was a flood of thank yous in the comments. So people are very much appreciative of the work that you and your team have done. So thank you for taking the time to come and present to us today. We really appreciate all that you're doing to secure these numbers and evidence of the changes in food security and household food insecurity here in Canada.
Well, thank you very much for including us. Thank you.